Good afternoon, everybody, and welcome to our COVID-19 professional webinar. This is Stephanie Hull, and I'm with the ESRD NCC. Thank you all for taking time out of your day to join us today. We appreciate your participation. And Matt, if you go to the next slide. So just going to go over what the agenda is today. So what is this call all about? Our speaker today is Liz Lear. She is the Senior Vice President, Executive Director of LifeLink of Florida. She's going to be talking today about organ donation and how the impacts of COVID-19. Everybody has been muted upon entry into our webinar, but we do want to hear from all of you. So please submit your questions through the chat or through the Q&A panels. We do want to hear from you, and we should have some time at the end of this presentation to answer some of those questions. So please submit those. Next slide. So what is this call about? During these webinars, we hear from different stakeholders and peers in the ESRD community who are adapting to this COVID-19 world. You'll be hearing some examples and providing real-world strategies for facilities to use. These calls are bi-monthly, and we have very differentiating varying calls from every other week to educate our ESRD community. Next slide. So let me introduce Liz Lear. She has served as the Senior Vice President and Executive Director of LifeLink of Florida since 2005. She joined the LifeLink team as the Assistant Executive Director in 1999. Liz earned her master's degree in Healthcare Administration and Bachelor of Science degree in Nursing from the University of South Florida. I'm going to go ahead and turn that over to Liz. Liz?
Okay, great, Stephanie. Thank you. And I wanted to say thank you to the ESRD NCC and Health Services Advisory Group, and most importantly, Stephanie, for inviting me here to speak today. I really appreciate the opportunity. Next slide, please. So what I really wanted to talk about today is organ transplants, and are organ transplants taking place during the COVID-19 outbreak? Most importantly, for this group, we'll have a focus on kidney transplants. So you'll see here the statements that came from the HHS related to the COVID-19 and transplant, and it recommended that every transplant program weigh the risk and benefits for their transplant candidates against the risk and benefits of acquiring COVID through transplantation. And each center needed to decide the best thing for their patients. Medicare issued guidance that identified organ transplants as Tier 3B procedures, meaning that they should not be postponed. CMS also recommended, and this was incredibly helpful for organ recovery organizations like mine, that hospitals continue to provide organ procurement organizations staff to hospital facilities for deceased organ donor recovery. So we'll talk a little bit about what all that means and how organ donation actually works. If we could get the next slide. Most importantly, what many of you are probably wondering is, should organs be used from donors who test positive for COVID-19? And there are statements out there on from the American Society of Transplantation and the Association of Organ Procurement Organizations, stating that they do not recommend transplantation of organs from donors known to have COVID-19 virus. We think this may change as more is known about the course and the treatment of COVID-19. One of the big questions right now is, what about individuals who have recovered from COVID-19? How long do we need to wait? What is safe? And I can tell you that organs are currently being transplanted from individuals who have recovered from COVID-19 and who can demonstrate recovery through a series of testing. So donation and transplant Clinicians should apply their medical judgment in instances where test results are pending at the time of organ offers, and that came to us again from the federal government. One of the things that OPOs have done all across the country is work to make testing available prior to organ recovery. So if we could look at the next slide. And let's take a look at all transplants to date in the United States. And you'll see that the green line is organ transplants in 2020, and the blue line is 2019. So in spite of the challenges related to COVID, organ transplants are continuing to happen. These lines include transplants from living donors, and we know that many individuals get kidneys from living-related donation. And the other type of donation, of course, is deceased organ donor donation. We could look at the next slide. Looking at this slide, we separate out living and deceased transplants to date in the United States. Again, the blue line is 2019, and you see living donor transplants, and most of these are kidney transplants, on the left side of the page. And in 2020, you see beginning in March that there was a decrease in the number of transplants from living donors here in the United States. On the graph on the right side, you see deceased donation. And you can see now that the green line is just slightly above the blue line. And that, to me, is absolutely incredible given the challenges that we have had with donation in the COVID setting. But currently, organ donation from deceased donors is ahead of pace for 2019. So 2020 results calendar year to date are above the 2019 results calendar year to date. If we look at the next slide, we can see these same impacts just looking at kidney donation. So kidney donation in the United States, and again, this is, or kidney transplants in the United States, this looks at donation from deceased donors as well as transplants from living donors. So looking at total kidney transplants in the U.S., 2019 numbers year to date are just slightly above 2020 numbers. And if we look at the next slide, please, we see the same thing that we saw with all transplants. On the slide on the left, living kidney transplants began decreasing in March of 2020, and they are still below calendar year to date, while deceased kidney transplants have been making up some of that deficit, because we're seeing an increase in the green line in 2020 in kidney transplants from deceased donors. Next slide, please. Here we take a look at organ donation and transplants coming from donors, both deceased and living, for 2020. And we compare that to 2019. And I would call your attention to the annualized column, and we see that we are expecting and currently annualizing at more organs transplanted in 2020 than we saw in 2019. And we've seen that over the years, we have seen increases every year in organs transplanted from deceased donors. But for me, it was really surprising to see that 2020 was actually going to surpass 2019, given the challenges that we have encountered. For living organs transplanted, we see that the actual numbers for 2020 are below the predicted numbers, and 2020 will annualize out with fewer living donations than deceased donations. That is because transplant centers really hesitated to put living donors at risk, particularly very early in the pandemic when it was difficult to obtain testing and to understand the risk for patients of actually being in the hospital. And we are very fortunate, I think, that deceased donation has continued on the pace that it has so that individuals are still able to get their transplants. If we can have the next slide, please. So I want to talk about the impacts for patients waiting, and we'll really focus on the waiting time for kidneys here for this group. We are projecting that fewer kidneys overall will be transplanted in 2020 as opposed to 2019, and that's because fewer kidneys are being transplanted from living donors. While deceased donation has increased, it does not make up all of that deficit. Many planned living-related kidney procedures were delayed, and I don't know if all of them will be able to happen in 2020. I suspect some may even be delayed into 2021. So we don't know the impact and what the status is of the transplants that were simply delayed for a little bit longer. I do think there is some good news for patients waiting. We have had some tremendous technology changes that we'll talk about that have helped support organ donation. We're seeing technologies that help the organs themselves, increasing use of kidney pumping, for example, to make more kidneys suitable for transplant. And we're seeing some improvements in the ability to track kidneys as they travel from one location to another. So I think those are all good news pieces of information for patients waiting for transplant. So next slide, please. If we could take a look at all the kidneys transplanted in the United States, and for 2020 annualized, we see again the increased number of kidneys transplanted coming from deceased donors as compared to living donors. Next slide, please. So I wanted to talk just a moment about UNOS, and that's the United Network for Organ Sharing. That's how organ sharing policies and procedures and regulations happen in this country. UNOS manages the list for those waiting for transplant. And as you might imagine, they had a number of changes related to the pandemic to help us work through all the issues that were presented. So donor screening. Organ recovery organizations screen deceased donors, and UNOS had policy changes related to donor screening for COVID, trying to get all the COVID testing done before an individual proceeded to the OR for organ recovery. To help increase the body of knowledge as it related to understanding the impacts of COVID on transplantation and specifically understanding instances of COVID transmission from organ donation, UNOS has implemented a policy requiring all new acquisition of COVID from on an organ recipient as a pathogen of special interest. So if a recipient receives an organ and they're COVID negative and then becomes positive, there's a special reporting for that to help us build up a body of knowledge about the potential for COVID transmission and organ transplantation. To date, we have not heard of that happening. But because we know other viruses can be transmitted through transplantation, I suspect that this is just a matter of time and that we will hear about that at some point in time. To accompany changes as it related to donor screening, we also had changes in transplant center policy related to testing recipients prior to transplant, particular follow-up required for recipients, and most importantly, the timing of that testing for recipients so that they are tested for COVID immediately prior to being transplanted. Organ recovery organizations and transplant centers rely on the Scientific Registry of Transplant Recipients, better known as the SRTR, to help us understand the statistics as they relate to both donation and transplantation. The SRTR statistics provide us with expectations for numbers and types of organs we should recover from specific donors, and they have expectations for transplant centers, particularly as it relates to the success of the transplant, the graft function from the transplant, and the additional life expectancy that an individual may expect to have from transplantation. COVID has really thrown a wrench in those statistics, and they've taken a temporary pause in statistics measuring both organ recovery organizations and the organs we recover, as well as transplant centers and their outcomes so that they can better understand the impact of COVID and some of the changes that we'll talk about here in the next few slides. Next slide, please. Organ donation happens from individuals who are in hospitals and intensive care units. Probably the single entity most impacted by COVID has been hospitals all across our nation. It is absolutely amazing to me that hospitals dealt with so many problems and complications, yet remain dedicated to working with their assigned organ recovery organization in identifying donor potential so that opportunities for donation were not lost. And in fact, we're seeing increased donation as we've seen all across the United States. It's really a miracle to me that hospitals have been so committed to the organ donation process with all the complications that they have faced. Organ recovery organizations work with hospitals to educate them on how to identify potential donors, and we do that by our staff being present in the hospital. So we were without our usual method to work on improving organ donation and working with hospitals, most importantly at the very beginning of this crisis and still somewhat today. So the process which organ recovery organizations manage and triage referrals and work with donor families, as you might imagine, has changed tremendously as it relates to COVID-19. So if we could have the next slide, please. The first thing I want to talk about is staffing challenges, and all of you have heard about the impact of COVID-19 on healthcare providers. All of the hospitals across the United States experienced stress on their nursing staff, their clinical staff that cares for patients, as those clinical staff workers became infected with COVID-19 themselves. All the hospitals across the country experienced staffing shortages. They experienced moving staff from one area of the hospital to another to deal with areas that may have COVID patients, may not have COVID patients. The challenges that hospitals faced during this time were absolutely amazing. And I think as a nation, we should be really proud of the work of our healthcare workers in hospitals all across the country. In our area here in Florida and in many areas of the country, there was real concern that ICU bed capacity would not meet the needs of COVID patients. And we saw particularly in some areas of the country where that in fact did play out. And there was great need to increase actual ICU bed capacity, increase ventilator capacity, and at the same time, hospitals were experiencing staffing shortages, bringing staff in who may not be familiar with that hospital or setting, and still needing to identify patients who had potential to become organ donors. So there was an awful lot going on in our hospitals, and they responded with incredible compassion for those families who they tried to care for through the worst day of their life, being compounded by all of the external challenges they were facing. So if I could have the next slide, please. One of those challenges was really entry into the hospital. All of the hospitals in our area went to a no visitor policy. They restricted access to hospitals. This was a common practice all across the country. And in areas with high community spread of COVID, you saw hospitals who just were not able to allow anyone into the hospital. Why was that a problem for organ recovery organizations? Because our staff need to go to hospitals to do our job. And we talked at the beginning of this presentation about the directive from CMS to continue to allow OPOs to have access so that organ donation could continue. And that's why this was so important. Families, however, in many cases were not able to be with their loved ones who had experienced a sudden terrible brain injury and who were potential organ donors. So we sent our staff to hospitals. They go to hospitals, they evaluate potential organ donors, they provide education for the hospital team members on the organ donation process. And we also have a responsibility to evaluate the effectiveness overall of the referral process. All of these tasks that we normally do, we had to do differently in this era of COVID in our hospitals. So if we could have the next slide, please. Probably most important for us was the issue of working with donor families. And if you could imagine your loved one sustaining a severe head injury, maybe your spouse or your child, and being admitted to an intensive care unit, and you were denied entry to the hospital. If you could imagine for that moment and put yourself in the place of those families, and you'll know what we were working with in trying to help those families. Additionally, especially here in Florida, many families don't live close to the person who may be here. And families did not have the ability to travel to hospitals, to travel great distances to be with their loved one in the hospital. So family members also had concerns for their own safety being in a healthcare environment if they were in fact able to be in a hospital. So there were many opportunities for our staff. We have staff in our OPO and in OPOs all across the country whose specialty is working with families on the worst day of their life to bring hope to someone who is waiting for that transplant. And they are incredibly gifted, and we really needed their skills. They were very creative all across the country and in our program here in Florida, finding how to connect with families in different ways. In many instances, they used a FaceTime or some other video chat service so that they could actually bring to families some sense of being with their loved ones, helping families see what was going on. And in many cases, our staff had the time to work with families and to spend additional time with families. That hospital staff who, as we all know, were terribly challenged in trying to care for more patients than is normally expected. So we were able to spend additional time with these families, find different ways to communicate with these families, sometimes going actually to where the family was to meet with them, sometimes connecting with them by video calls. But in every instance, I think giving the families more of a vision and some comfort to know what was going on at the hospital with their loved ones. And together we worked through many, many challenges, as you might imagine. So next slide, please. We know that there have been many challenges as it relates to COVID-19 screening and testing. At the very beginning of this pandemic, we had to work very quickly to get stat testing available for potential organ donors. We were very fortunate to work with a large transplant center here, and OPOs all across the country set aside different methods to obtain the best possible testing for organ donors. In many cases, this involved having to fly specimens, and sometimes at the very beginning of the pandemic, even swabs to obtain specimens from one location to another, so that we could, in fact, have a test available for an organ donor in as quick a turnaround time as possible, so that we could make donation happen and continue to bring organs for transplant for those in need. So testing at the very beginning of the pandemic was quite the challenge for all of us to implement on a very rapid basis. And we are very fortunate for all the partners who work with us to help us accomplish that. That still remains an issue somewhat today. We know that in our community, it's not always possible. Rapid testing doesn't provide us with the best information for safety as it relates to potential organs for transplant. We are working to get PCR testing on all of our organ donors. That takes a few more hours, but we do have stat testing available, but it's been quite a struggle working through all of those testing challenges. In addition to PCR testing for COVID, OPOs also screen organ donors with a series of tests helping identify all diseases that may be transmitted, but in this case we've added several as it relates to COVID. Obvious temperature screenings and look-back procedures, as well as family questions to try to identify any disease exposure. We're also getting CT scans of the chest on all our potential organ donors and compiling all that information so that transplant centers can make the best risk decisions for their recipients. As I mentioned earlier, transplant centers also need to screen recipients, and that has to happen immediately prior to the transplant so that that can be the most, give us the best information. Transplant recipients are immunocompromised to allow them to accept their organ for transplant. So they are at great risk for disease acquisition, and we want to be sure that we're not immunosuppressing a person who already is infected with COVID, because we're not sure how that will go. So that's been an important aspect as well. And getting patients potential recipients transplanted, getting all the testing that we need for the donors has actually caused some delays in an organ donation process as we work through all of those things. Normally, from the time of authorization till the time we are in the operating room recovering organs for transplant, it's about 24 hours. And our timing has gone just a little bit higher than that to allow all of the additional testing and screening and some of those things to happen. Next slide, please. We send staff to donor hospitals, as I mentioned, and OPOs in the United States go to every hospital in this country. And all of our hospitals, as well as our organ recovery organizations, we did not have enough PPE supplies. Normally when our staff goes to a hospital, the hospital supplies them with supplies, and many hospitals were running really low on PPE supplies. So that was a challenge for us at the beginning of this pandemic because we didn't have all the PPE that we needed, and I think many people had issues with those very same things. Additionally, hospital entry requirements, our staff are temperature screened and all the various things that hospitals do, but there's a lot of time sensitivity to getting to a hospital at the right time to talk with families, and in many cases our staff were waiting outside in the heat here in Florida in long lines to try to get into the hospital, and in a few cases they got pretty hot waiting out in those lines, and that we had some issues there. Testing was a huge obstacle for us to overcome. As I mentioned here, we were really fortunate to work with a transplant center that was very forward-thinking in terms of developing a COVID test. Scarce hospital resources, including all sorts of staffing and all sorts of ancillary services that we need for testing on organ donors. Many times, hospitals had staffing shortages that might include the pathology department or the radiology department or some other department that made it difficult to get the testing and services that we needed. And interestingly, we didn't anticipate this, but most hospitals shut their hospital cafeteria, and even obtaining food for our staff who was in the hospital and couldn't leave because of the screening procedures, that made that difficult for us as well. So challenges that we didn't anticipate to work through. Next slide, please. This was another challenge that we faced. As we know, all across the country, there were differing rates of disease transmission. Organs are allocated via a national scheme, and it just so happens that the timing of COVID happened at a time when we were working on broader national sharing of organs for transplantation. And that presented some real problems for us. Organ donors happen from ICUs, hospitals and ICUs all across the country. And those hospitals would have to allow visiting teams, maybe from another state, to come in to recover organs for transplant. That's how the system normally works. We access the national list. Organs are allocated to the patients in the greatest need, and those transplant centers have the opportunity to come and recover those organs for transplant. So here in Florida, the first issues that we had were with some of our community hospitals who were not excited about having surgeons from New York or New Jersey come to Florida. And then, of course, Florida started having increasing rates of COVID. And when our transplant centers needed to travel to other states, they weren't real excited about having us come either. All across the nation, organ recovery organizations worked on better methods to have organs recovered locally so that only the organs would be moving across the country, and they would, for the most part, travel unescorted across the country instead of traveling with the surgeon that recovered them. So that led to the next problem, and the next slide. Because as we all know, there was at the same time a tremendous decrease in the availability to move things via air. Decreased number of commercial flights. Kidneys normally travel via commercial air carriers, and there has been a tremendous decrease in the frequency and the availability of flights. Organ donors can happen any time of the day, and currently in the U.S. there's a tremendous decrease in the flights available, particularly in the evening. So that has been a little made kidney transportation more difficult. At the same time, OPOs are working with several companies to have better tracking of organs that may be traveling independently, especially kidneys, with a GPS tracking systems on those kidneys. But overall increase in challenges in transportation of organs all across the country. Next slide, please. So outcomes. COVID-19 really presented the perfect storm to see a decrease in organ transplantation all across our country. And yet that is not what happened. Hospitals, OPOs, and transplant centers have partnered together to ensure that, in fact, deceased organ donation rates continue to increase in 2020. And I give much credit to our transplant center partners who have taken every step possible to protect their patients and continue to transplant their patients safely, efficiently, and effectively, overcoming really insurmountable odds to do so. Community hospitals, I cannot say enough good things about community hospitals. With all of the struggles that they have had, we have seen tremendous support from community hospitals to help families on the worst day of their life, to remember those patients who need an organ transplant, to save their life, and to do their part to help this process happen. Many of you have seen videos of things like honor walks that have occurred in ICUs all across the country prior to this COVID pandemic. Some of our hospitals have even been able to do honor walks during this pandemic with all sorts of special precautions to truly honor organ donors for the heroes that they are. I saw someone post something on the chat here that said, "Yay, good news for once," and it is amazing good news. Your patients who need kidney transplants, we are still making those transplants available. Those transplants are safe for those patients who need them. And I'm amazed by all the great work. And we are really happy to be your partners in getting people safely transplanted. I know some questions have come in. I think we're to the question and answer part of this presentation. I want to thank you so much for your time and attention.
Thank you, Liz. That was a great presentation. And we do have quite a few questions that have come in through the chat. So just a reminder to our participants, if you do have questions for Liz, please submit them. You can use this chat or the Q&A feature. But let's go ahead and get started because there is some in there and we do have some time. So the first question, Liz, are these statistically significant differences between the 2019 and 2020 deceased transplant recipients?
I have not looked at the statistically significant difference. I saw some news the other day that said there was about 600 more transplants this time in 2020 than there was in 2019. And, I can't do that statistical math in the top of my head. But what I can tell you, I've been in this field for 23 years now, and I never would have expected that organ donation would continue anywhere near the level that we saw in 2020, given the challenges that we were facing. The identification of the potential organ donor in an ICU, it is a small fraction of the deaths that occur annually. It's only people with a severe brain injury, very near brain death, or actually brain dead for most of these donors. And that is a very, very small number of the deaths that occur annually in this country. So that identification process is so important. And when I thought about hospitals and ICUs that were experienced critical staffing shortages, and using staff that wasn't familiar with that ICU, I expected the number to be lower. So the fact that we're seeing more organ transplants in 2020 than 2019, whether it's statistically significant or not, I can't answer, but it is so much more than I expected to see given the conditions that we're facing.
Right, exactly. Thank you. Okay, another question. Since a positive RT-PCR test rules out a potential organ donor and the high false positive COVID-19 tests, are there any discussions you are aware in challenging the automatic COVID-19 rule out, possibly similar to the HOPE Act?
That's a great question. And the thing about the HOPE Act, and for those of you who don't know, the HOPE Act was signed into law by President Obama, and that allows for transplant from donors who are HIV positive to recipients who are also HIV positive. The HOPE Act benefits from years of knowledge about HIV, from good drugs to treat HIV, and just from the absolute knowledge of CD4 counts and helper T cells and all those things that matter in HIV, there's a tremendous body of knowledge that actually is allowing those transplants to happen safely. Individuals who were HIV positive were being transplanted with HIV negative organs, and they learned how to manage immunosuppression in those patients. We don't have any of that right now with COVID. We don't have that body of knowledge, that body of scientific knowledge that has allowed the HOPE Act, which I think is absolutely tremendous. And I think the person who asked the question was probably thinking some of the time HIV tests may be a false positive, and that has been true, and those organs have been transplanted under the HOPE Act when they otherwise may not have been. With COVID testing, so far we don't know everything that we don't know. We're actually more concerned about a false negative test than a false positive test, because we will walk away from a donor whose COVID test right now is positive, because we don't know a safe way to do that. We're really more concerned about a test that might be negative and might be a false negative. And that's why we're doing the CT scans of the chest and all of those other things to try to identify that information. Because again, recipients are going to be immunosuppressed, and we just don't know enough about COVID to know how that will go.
Yes. Lots to learn yet. Great, thank you. We have another question. It says, you addressed that deceased kidney transplant numbers have actually increased from 2019. Do you have statistics on the number of donors? It's kind of part one. And then, as this would obviously affect wait times across the country, would the numbers of transplants completed have been even higher than more donor kidneys been able to be used?
So in 2020, we saw a decrease in living donor transplants, and most of those, as I know you know, are kidney transplants. And we see an increase in deceased donor transplants, particularly of kidneys, which I think is really good news. We are seeing more organ donors, yes, in 2020 so far than 2019. Some things are not equal in both years. And I think that's hard to make an exact comparison. So at the very beginning of COVID, transplant centers were focusing on transplanting those recipients who do not have an opportunity to wait. So individuals who were very ill and would not survive a few more months. So even the types of patients who got transplanted are not entirely the same. The waiting time for kidneys in the United States is disturbingly long, and the organ recovery organizations all across the country are relentless in our pursuit to recover more donors, to make more kidneys available for transplant, to continually refine and improve our processes, because we recognize that deaths on the waiting list happen, that dialysis is not a way to live, and we are continually working to increase the number of deceased kidneys available for transplant. We're really excited by the increase in the opportunity to pump kidneys, to make more of those kidneys available for transplant. There are new technologies coming out to increase. There's some warm pumping methodologies. There's all kinds of things in the works to try to make more of the organs that are recovered for transplant safe for recipients and effective for recipients.
Great.
I don't know if that answered the question.
All right, thank you. Yeah. Next question here, it says, have the costs associated with donation risen due to the extra obstacles such as the reduced commercial flights, and are patients encountering higher co-pays as a result?
You know, I don't know anything about the co-pays on the transplant center side, but OPO costs, you know, there's been some shifting in costs, I would say. Some of the things that we were doing previous to this were not. So, and quite frankly, our cost report information isn't in and available, but I don't sense that there's going to be any sort of cost increase. We're working with the airlines to try to get kidneys on flights whenever possible. More when that's not possible, we see organs staying closer, so that would actually represent a decrease in cost.
Right. Okay, great. The previous question, the participant clarified. She says, what I was asking was, has the number of deceased donors with viable kidneys decreased because of COVID?
No. Have we had donors ruled out because of COVID? Yes. One of the things that's happening across the country is there are more deaths, not all of them due to COVID, some due to individuals who didn't seek, care in time, and that's an additional tragedy related to COVID. But there is nothing specific to COVID and kidneys that would make kidneys less available from deceased donors. Not all kidneys from deceased donors are able to be used. Sometimes deceased donors have their own kidney disease. Sometimes kidneys suffer from the effects of whatever led to the death, but I don't see any change related to COVID and deceased kidneys specifically from individuals who are able to be donors. That should be of a concern.
Okay, great. We have time just for a couple more, and we do have a few more questions. It says, apologies, did I miss the part that in the future, anybody who tests positive for COVID will not be able to donate until further notice?
So, no. We talked a little bit about that, and what we said is we're still working on that and how we can do that safely. We, in our program, I know of 2 donors who had previously tested positive for COVID, been treated for COVID, and then been followed and had a series of negative tests, and then in the event that led to their death, were tested and were negative. And they were able to be organ donors. So the thought is, if we cannot detect circulating virus via the PCR test and we're several weeks past a positive test, then we would be able to make them organ donors. We've done that. Those cases are very recent, and we don't have any notifications of problems so far.
Okay, great. Thank you. A couple more here I think we have time for. So it says, for individuals who have recovered from COVID-19, is it up to the individual transplant center if their organs are able to be transplanted?
So every transplant center needs to evaluate, and generally it's a evaluation for that specific patient, weigh the benefits and the risk for that patient of receiving that specific organ. And that happens on a routine basis with all organs that we offer for transplant. So a person who had COVID and successfully recovered and died a month or a year later, I don't think that a transplant center would have any concerns whatsoever.
Okay. Another question here. It says, how do you suggest providers mitigate the fact that facilities are overwhelmed and patients are not taking the initiative to continue the transplant wait listing process? Transplant centers are saying patients are not returning their calls or using telehealth.
I think that we are seeing that all across the country, people are reticent to seek health care. They are concerned about being in environments with others who may expose them to COVID. I think that has partially led to some of the increases in deaths that we're seeing. I think that's tremendously unfortunate. And what I want to tell you today and our partners in renal health is that transplant remains a safe alternative for your patients. Fear of COVID should not be holding anybody back from completing their transplant evaluation.
Great, thank you. this question, I think we might have touched on, but let me just present it to you again, Liz. It says, what do you credit the increased cadaver donor numbers if no data was in your educated guess? What is your educated guess?
So, I think that one of the things that we have experienced in families who weren't able to be at the bedside were grateful for the discussions that helped them understand what was going on, grateful for the opportunity to spend time with the senior care coordinators from the OPO side. And because many families were just in a state of anxiety themselves, for some reason, families have been better able to make that decision to donate. That's my educated guess from what I've seen. It's not a scientific answer. We have been working many years to increase donation, and I think some of those efforts also played a part here as well.
Correct. Yep, absolutely. Well, great. It is almost toward the top of the hour, so I think thank you again. And there was a lot of good questions. Thank you, participants, to submit those. A lot of good discussion today. Matt, if you can go to the next slide. We will go ahead and wrap up. I just want to bring your attention to the kidneylearninghub.org. This is a secure and mobile-friendly web tool for patients and professionals. It was developed by the ESRD NCC with assistance from our patient subject matter experts. There are lots of good information, a lot of good links about COVID, about transplant home, ESRD education, also has access to the patient grant library, understanding high KDPI and increased kidney risk videos. So please, visit that or bookmark that to your device's home screen. So just a quick note when our next COVID-19 webinar events are. The patient focused event will be October 6th at 4 p.m. The next provider or professional one will be October 14th at 3 p.m. You can always visit our website, kidneycovidinfocenter.com, for more information and to register for upcoming events. Next slide. As a reminder, if you do need CEUs for nurses, social workers, or dietitians, please just after we close out, you should get a pop-up that will take you to the survey. After you submit the survey, it will then take you to our learning management system for the CEU certificate. If you do not get that pop-up, you can email us at nccinfo@hsag.com. We will be able to help you, assist you with those CEUs. So that is it for today. Thank you all for attending. Thank you for taking time out of your day to join us today, and hope to see you on a future COVID-19 webinar. Thank you, everybody.